A first tonight in Utah's fight against COVID-19. This graph shows the state's 7-day positive rate is now the highest it's been since the pandemic started, with another 2,100 Utahns infected with the virus.
State health officials also confirming another 4 Utahns have lost their lives to COVID. That means 1,305 people have died in the last 10 months. Right now, 484 people are being treated for COVID in our local hospitals. And the fear is these numbers could surge now that the holidays are finally over. We do have team coverage tonight, including changes to school quarantine protocols and more people lining up to get vaccinated.
But we start with Jed Bull, who has more on that spiking positive rate, which is one of the highest in the nation. Jed?
Yeah, Deanie, right now, Utah has the 9th highest positivity rate in the nation at just over 30%, which an infectious disease doctor here at Intermountain Healthcare called very high. Dr. Todd Vento says that positivity rate tells him community transmission is still very high. There is a lot of infection in the community that they are not catching with testing, and we will continue to see high case counts that lead to hospitalizations. After each long holiday weekend during the pandemic, Utah saw a rise in COVID cases. So following the longer Christmas and New Year's holidays, Vento expects to see a similar rise, although the rise in cases after Thanksgiving was much less than health officials had expected. The positivity rate here and across the country, he says, is still way above any level that would indicate control of the virus.
If you're still having percent positivity in the 30% range, that's very high. And remember, the WHO and the CDC had put out, try to get it below 5%. That shows excellent control. And
the infectious disease doctor points out that it has been many, many months since any state has had a positivity rate as low as 5%. Vento says they'll be tracking the rolling averages of cases and the positivity rate over the next couple of weeks to see what they show about our behavior during the last few weeks. But that high positivity rate, he believes, is certainly an indication that we will see another rise in COVID cases.